Welcome back, everybody, and thanks for your good timekeeping again. We're on track and on schedule. And thanks to the previous speakers for staying on time. And again, our lords, the presenters in the next session, to equally stay on time so we can have a good time for deliberation and discussion at the end of the panel. So again, like the first earlier panel, I'm going to introduce the speakers individually, and then we'll have a combined panel session. So first of all, and we are looking at this stage at this session on strategic services delivery partnership. So I'll ask firstly Dr Eamon Keenan to take the floor, and Eamon is the clinical lead in the HSC for addiction services. So Eamon, over to yourself.
Thanks, Paul, and good morning, everybody. So I'm conscious that I have a very strict chair, and I'm conscious that you guys all got the slides yesterday. So I'm going to fly through the presentation a little bit. I'm going to stop at a couple of slides, and I'm going to talk. In terms of drug treatment in Ireland, these are the figures from the HSE in relation to combining the HRB figures and the people who are in receipt of treatment for opioid services. So in 2021, we had over 23,000 cases receiving treatment, and that's gone up since 2014. 2/3 of them were for opioids. Cocaine was 16%, cannabis 11%. So the main focus of our treatment services is towards opioids, towards heroin, towards the provision of opioid substitution treatment. And this developed over a number of years. This has been a number of years in the making. We had a unique approach to opioid use in the 1990s. And it involved the statutory services, the HSE, or the health board at the time, going out into the communities, having meetings in the communities. And when I say meetings in the communities, I mean in people's kitchens, in community halls, in parish halls. And we developed a response in relation to opioids in conjunction with the community. So what happened was, we provided treatment, we came into the area, we provided treatment, and the community living in that area identified the people who had the problems and got those people to us. So it was a real partnership approach, and you'll hear about one of those projects a little bit later when Jad, Tommy Gilson, whose father I knew, worked with in Jobstown many years ago, developed an initiative around that approach. So opioids continue to dominate our treatment landscape, and we do know that services work. But now, cocaine and cannabis are what's really presenting for treatment. The number of people presenting for treatment for opioids has been decreasing, new cases decreasing, but we've seen a big shift up in cocaine, and we've seen a shift in terms of young people using cannabis. Mainly under 19s, cannabis is the main drug which is requiring treatment in this country at the minute. And that's very different from what it was in the 1990s. In the 1990s, we had a lot of young people using heroin, and I think we forget that. I remember at one stage having the needle exchange program, and we had to engage with legal in the health board to see, can we give needles to under 18s, because we had people coming up to our needle exchange programs in their school uniforms. We don't see that now. We don't see young people presenting for treatment around heroin, but we do see it in relation to cannabis. The challenge we have in relation to cocaine and cannabis is that there isn't a medication, there isn't a methadone, there isn't a buprenorphine that we can prescribe. Yet people are having lots of harms, lots of difficulties. We need to expand our psychosocial interventions, counselling, support, and yes, they will need medication if they're having the significant mental health problems that are associated with these drugs. And mental health problems are associated with the drugs because we know that the cocaine strength is increasing. We've been going to festivals, we've been checking at festivals, we've seen that, we've put out warnings. The strength of cocaine is high. The cannabis potency is higher. People are going to have more problems when you have stronger substances circulating. So we really need to ramp up our psychosocial interventions. So we talk about, you have the information there about cocaine, the information about cannabis. And just to talk a little bit about, since the last time I was here, we have put in place the dual diagnosis clinical program. That model of care was launched in May, and we're rolling it out at a couple of pilot sites. But rolling it out at a couple of pilot sites is like putting your finger in the dike, because it's going to take time to get services up and running. Then they're going to have to be evaluated. It's not rocket science. People need treatment. We need to prioritise the dual diagnosis clinical programme to get funding across the country. We also are going to be having a dual diagnosis rehabilitation centre in Keltoy. And in terms of our residential treatment services, we have over 50 services with over 1,000 beds. The thing I just want to point out about this is a bed isn't necessarily the end point or the solution to problems associated with drug use. It might be a start for some people, but community-based treatment is really what works. And when somebody leaves a residential programme, they need to be able to access services. They need a job, they need a house, they need education, they need opportunities. We have to build that recovery. Harm reduction, you've heard a lot about. Needle exchange, we have 90 pharmacies across the country providing pharmacy needle exchange. Naloxone, we heard about drug-related deaths this morning. Naloxone is how we are going to cope with that and try and deal with that. It reverses the effects of an opioid overdose. We're increasing up the programme. We've trained over 500 people in 2023, and we've administered it on 89 occasions so far this year. That's potentially 89 people whose lives have been saved through this programme, but we need to ramp it up. I've been working with stakeholders over the last 4 years trying to get them to engage in training. We need those stakeholders to be able to get training so they can provide naloxone, and we need to think about legislation change to get naloxone off prescription so that it's available in pharmacies and people like the police can carry it around in their squad cars. Supervised injecting facility, yes, we're working on that. We've got the planning permission finally. Hidden harm in relation to people, families and children who are living and affected by the parental problem of alcohol and other drug use. So we're working closely with Child and Family Agency, TUSLA, in relation to this. Health diversion, we've heard a lot about it. We've heard the Portuguese model. This is the Irish model. But Jim Wall said this morning, it's been 4 years in the making. I'm really urging you now to say that the legislation process is far too slow. We need to have the legislation enacted so that people, the guard who comes across somebody in possession of drugs, can make that referral to myself in the health service. We're ready to take those referrals. That legislation isn't in place to allow that to happen. The drug monitoring, you're going to hear about that this afternoon from my colleague Nikki Colleen. This is really important because it allows us to know what substances are circulating, and it allows us to put out public health alerts at events like festivals. We also do syringe analysis, hair analysis, and wastewater analysis. So what I'm saying now is that Europe's drug problems have become more complex, and we're part of Europe, and our problems mirror what's going on in Europe. We have to think about the fact that drugs are everywhere. Almost everything can be a drug, and everyone can be affected, either directly or indirectly, about drugs. So I have a number of recommendations, you can read them, but really what I want to say is we have a unique opportunity, and you have a unique opportunity here to shape things for the next 10 years. You guys are going to be producing recommendations. The government are going to have to listen to your recommendations. They don't have to listen to my recommendations because my recommendations might cost money. But if they don't listen to your recommendations, they're going to lose votes, okay? So it's really important. The recommendations that you make are going to shape our response over the next 10 years. We have to look at prevention. We have to look at approaches which will reduce the number of people in our society who are suffering harms due to drugs. Prevention has to be prioritised, and that's not necessarily just a health intervention. That's right across education, employment. Lots of different government agencies need to step up to the mark. Treatment expansion needs to be prioritised. We know that treatment works. We've seen the fact that for opioids, the treatment, we're not seeing young people anymore. New cases are dropping off. We need that sustained investment for cocaine. We need a sustained investment for cannabis. And it's not just about beds. It's not just about beds. Rehabilitation and recovery are really important so that when the person leaves, they can...
Just 1 minute, Eamon, please.
Okay, they can have a job, they can have somewhere to live, they can have education, and they have family support. So we need real buy-in from the government in relation to this. And what I'm saying to you is that we need a cabinet committee where the Taoiseach is at the table talking about drug-related problems in our society, to move forward all those departments who are a bit slow sometimes in producing response. I've talked about 4 years. 4 years is a lifetime for somebody who's using drugs. So we need buy-in with Cabinet Committee, with Taoiseach actually telling people what to do and when to do it. And I think in 10 years' time, what I would love to see is that people from abroad are coming to Ireland and saying, what have you done? How did you turn the problem around? How did you deal with the problem you were having? And we're going to say to them, it started with the Citizens' Assembly. Thank you.